The best estimate by leading vaccine producers is that it could take a year or more to develop, test, and manufacture a vaccine for the clade X virus.
We have heard that 500,000 children have died. You know, is the price worth it? We think the price is worth it.
Richie Brown Show.
Welcome to the Richie Brown Show. Today I have a tweet from GeoFio8 at GeoFio8. This person does excellent work, and it's another video from Biology Phenom, who runs immense stack for very good work. Session highlights featuring bereaved relative groups from all four corners of the UK, Scotland, England, Northern Ireland and Wales, the UK COVID-19 inquiry. Module 6 sector hearings were held from 30th June to 1st July. All there to see. Over the last 5 weeks of hearings, what has been revealed: inhumane isolation, end of life, drugs, lockdown deterioration, end of life visits denied, blanket DNA CPR notified without consent, DNA CPR see for do not. DNA CPRs apply to healthy 20-year-olds. This fucking inappropriate end of life care, human rights disregarded, options outweighed COVID, risk COVID, question cause death. Now these are all things that are covered in my unseen documentary, like the DNA CPRs. They're applying them willy-nilly, applying them to healthy 20-year-olds. Very strange. And as usual, sticking COVID on the death certificates. Changing death certificates was a crime at Nuremberg, and doctors and nurses, admittedly a very small percentage of those were eventually to Nuremberg. Drinks party at Downing Street as relatively restricted funerals. The majority of the crucial evidence at the UK's biggest public ever inquiry, unreported by both mainstream and alternative media and various other platforms and personalities, said to be speaking out to inform people. All right, let's get into the video.
And certainly within your statement at paragraph 11, what you explain is that you had to try and say goodbye to your mum that day, not knowing when you would have any physical contact or see her again, effectively in that sense.
Absolutely, and the physical contact turned out to be never. I never had that again with her, and that was 10 months prior to her death. So it seemed extraordinarily cruel and inhumane to be kept apart for that length of time. And
later in January of 2021, when your mum contracted COVID, and you explained that she had no real symptoms of COVID and appeared asymptomatic. Is that right?
She did. She was by this stage on the oxygen, but she didn't appear to be struggling with her breathing. There was no coughing, nothing that suggested to me that she had COVID. It did seem asymptomatic, yes.
And were you able to see your mum initially following that diagnosis?
No. It seemed so cruel. I couldn't be posing any kind of threat at that point. So, as I said, for 10 months, even as she lay dying, I could have no physical contact with her.
Do you remember what the doctor said?
The doctor said, we don't take COVID-positive residents to hospital. Order the end-of-life pack.
And did it appear to you at the time that your dad was in need of an end-of-life pack?
It appeared to me at the time that Dad needed oxygen and support. And I knew that he needed help if he was going to recover.
Is it right that you yourself called 111?
I did. I think in the end it was possibly 2 a.m. before I managed to speak to somebody. But I'd read in the press a statement from the local medical director a week earlier saying that there was absolutely no barrier to care home residents with COVID going into hospital, and that they were sitting at 55% occupancy, and there was absolutely no reason why they wouldn't be admitted.
You know your own mother best, and you know what affects her. If she was resilient and outgoing and asking lots of questions, I probably wouldn't have been so doubtful. But knowing her personality and knowing that she wasn't a big eater, my fear was that without seeing a family member, any family member or even just one, that she would deteriorate. If they were to say they were following guidelines, I don't understand any guideline that keeps a family member out from a dying parent in their last hours. If they didn't get in during COVID, that was bad enough. But end-of-life care, to me, is a human right.
That relief of the oxygen, although it's little, we knew there was not much we could do, but there was no relief for this woman. It was horrific. And unfortunately, Vern saw that. He didn't get involved with the death of patients, but that was horrific. And she was just begging him for help. But yeah, it was, by the time we got the swab for her, she'd gone. She died, unfortunately, horrifically.
Obviously, things were significantly restricted. Did you see any decline in their mental, cognitive and physical abilities as a consequence?
Of being isolated?
Being isolated.
Yeah, what we did was those who could, we gave them all, or I asked the relatives to bring in individual mobile phones so they could speak to them over the phone, because we didn't, as I say, we didn't have very good Wi-Fi, so they couldn't FaceTime anybody or the relatives. But yes, they became quite sad and isolated. But I must admit, they knew what was going on. Even though my patients were quite poorly, I didn't have many with dementia, so they knew what was going on, and they were quite happy to be isolated from other patients. But their mental health did suffer because of that.
Of course. But I want to concentrate, if I may, upon your requests for medical assistance and oxygen in particular.
Yeah.
Her oxygen levels were low.
Yes.
And you sought a prescription, is that right?
That's right.
And what response did you get?
This lady became quite poorly very quickly. She was a very fit lady, and I noticed she became quite poorly. Her temperature was rising, and she did start with a bit of a cough. So we rang the GP. Of course, with the Wi-Fi, we couldn't get an accurate picture because the Wi-Fi would break up, so she couldn't see her. So I said to the GP, she was a locum GP, she wasn't a local GP, and I said, I need some oxygen for this lady and some antibiotics. So she prescribed the antibiotics, and she did say to me, how do I do the oxygen? So I said, when you write me a prescription, we come and pick it up, and we take it to the chemist, and then we get some oxygen, or whichever body where we take the prescription to, and we get the oxygen. So she said that, well, the prescriptions will be here tonight. So we picked up the prescription from the GP's practice. By this time it was 6 o'clock, so everywhere was closed, so I couldn't get any oxygen. So the very next day, I rang her own GP, who was then back on duty, and I said the same thing to them. This lady's deteriorating overnight, she's very poorly, I need some oxygen, we've picked up the antibiotics, I need the oxygen, I need it ASAP, because our oxygen levels are dropping down, and she prescribed end-of-life drugs. And we never, ever got the oxygen, ever.
Indeed, thank you. I just want to move to a related topic, which is do not attempt cardiopulmonary resuscitation notices. And you explain in your statement that all GPs have put in place DNA CPRs on their patients. Was that all of your patients in the care home?
Yeah. Yes, I came back from a meeting and 50% of them had already had the paperwork in place because they'd been sent to them, and then they had all had DNRs in place.
And was there, to your knowledge, any consultation with the patient or their families?
No. I managed to speak to some of the patients' relatives before this was slightly before lockdown this was happening, this was before lockdown, and two of the relatives, I managed to get in touch with them, and they got hold of their GP, and it was removed, because they didn't agree with it. They spoke to their parents about it, and they didn't want it in place either, and it was removed. That's the only two.
And prior to lockdown, where there were those notices in place, would nonetheless that individual be taken to hospital if necessary?
If what, sorry?
If there was a notice in place for an individual patient of yours, would they nonetheless be taken to hospital for treatment?
Yes.
Did you see any change in that during the pandemic?
Yes. We found that ambulance drivers and paramedics were not happy to transport any patients to hospital if that needs, like when that lady fell, unless there was a DNR in place. And I'd never come across that before. So that was a relatively new consequence for me.
That woman was in the Unseen documentary. Absolutely shocking what's going on here. It does make you think. The only reasonable explanation you can come to is that they were trying to spike the amount of excess deaths for that year.
Can I please ask you about DNA CPR decisions, please? You received a letter from Sarah's GP surgery asking to confirm your preferences. This is the first letter you received. How did you feel when you received that letter?
Well, I was incandescent. As I said, I'd come across in the NHS before this tacit attitude that resources were wasted on her. For instance, they wouldn't pin her collarbone when she broke it. And I just thought this is yet another example of the NHS seeing her as a second-class citizen, and although she has human rights under the Human Rights Act, these are being disregarded, really. And, she was a healthy young woman in her 20s, apart from the epilepsy, and at that time, she was in better health than the rest of us. So I had suspicions that for her, it would be no more than flu. And I didn't see why I should agree to a DNA CPR for a healthy young woman in her 20s.
Did the restrictions, in your view, balance the needs of someone like Sarah with Sarah's needs, with the risks that COVID-19 presented to her as an individual?
No. I felt, as I said, none of us knew very much then about COVID, but I had the suspicion that as a healthy young person in their 20s, it might be no more than flu. And in that case, I felt the risk to her from her epilepsy far outweighed the risk to her from COVID. We'd been told by a Great Ormond Street consultant that when she was at the residential school, and we spoke to her on the phone in the evenings, we were not to bring up anything stressful. She was worried that Sarah would die in the night from sudden death in epilepsy. So we've always got that in the back of our minds every day. Today she could fall downstairs and break her neck during seizure. Tonight she could suffer sudden death in epilepsy. And we've been told she's in the highest risk group. And it seemed to me no attention was paid to the risks from her epilepsy, which for us far outweighed what we thought about COVID. They never seem to say we have also sought advice from consultant neurologists to see how we can balance the needs of the COVID with the needs from her epilepsy. And it seemed like the COVID was the only concern, and her epilepsy, which actually was far more life-threatening, never came into consideration.
I think you say in your statement that you felt there was a complete lack of a bedside manner on display by both the GP, and it's indicative of the system as a whole in relation to bereavement support.
Yes, it felt brutal, and in view of Dad's robust physical health, to place a DNA CPR on him appeared to be simply because of his age.
The impact that medication had upon Cheryl, indeed in your statement you describe her as becoming drowsy because of the medication changes, became less able to communicate, to hold those conversations. What impact did that have upon you and your attempts to communicate with her, but also James?
It affected James, and it still has very much affected her son to this date, with things that will come, things that he'll say, and he's thinking what happened to his mum. It has still affected him. When he was going to go into the medical profession, he'd got all his qualifications. When this happened to his mum, he said, I'm not going to do that anymore, Grandma. He said, my mum got neglected, and that is how and he still feels like that, as I very much do, that not so much but when it comes to the hospital side, things just went haywire as well. But leading on from the nursing home, they just seemed to keep giving her pills. She was supposed to have this and she was supposed to have that. Then the morphine, they started giving her Orimorph, and that got increased, which was a morphine-based drug as well. And that was because of the pain, which was supposed to be for UTIs, which I found strange.
She was very unwell at that stage. and the hospital told you that her kidneys were failing. Were they going to provide further treatment, or was it effectively palliative care for end of life?
Yes, it was palliative care. Because it's only, as I say, going through the notes, even from the hospital, which I've gone over again and again to see if there's anything. From the day of admission, when she first went into this first particular ward, and they actually took her case before the care team, the ITU care team, and the questions that were asked, was she suitable for ventilation? No. So every single thing, even right down to renal interaction, which I don't know why that came into it, and it all been ticked off as no.
And how did that make you feel at the time?
Well, devastated, absolutely devastated. Why, if she's getting treated for UTIs, all of a sudden she can't have anything done, nothing at all. When I'm getting told that there's no evidence yet of COVID, any test results, why can they say no to everything when they haven't had any results back?
And you explained in your statement you were very angry at the time.
I was angry when that doctor rang me 2:45 in the morning, because I'd spoken to me. I was angry and I was upset. In fact, I was very angry when she told me my daughter was dying. And unfortunately, I absolutely screamed down the phone, because it's how I felt, and I still feel it to this day, that she had got dumped on the scrap heap because of her disabilities, and that is how I really feel about it.
I think it was an entire eugenics campaign waged because they don't want to pay out so many pensions. In Michael Belay's book on Death and Deliverance, he goes through how the Nazis had to clear the decks for war, and that was why they implemented Action T4, the eugenics program, which basically pushed similar things like this.
And you touched on this already, but of course things changed quite significantly when the pandemic struck,
yes,
and you were no longer able to visit. You explained a moment ago that the care home was locked down with no notice. How did you find out that the care home was closing so that you could no longer visit?
A sign on the door, just on the glass door.
Had you gone to visit on that
Yes,
occasion?
we went to visit. We were up checking around my father's home because that was vacant. We hadn't been in the home. And as I say, that was passing anyway, but I called down and there was just a sign on the door. No explanation, no phone messages, no emails, nothing.
And were you ever able to see your father again after that day?
No.
You explain in your statement you do not really know the circumstances of his death or the treatment that he received.
No, not a thing. I listened to the professor earlier and he said about the CPR. On my father's death certificate, it took us a long while to receive it. COVID was first, with heart failure second. And we don't know now, did his heart stop? Did his heart failure kill him? Did the CPR? Did the COVID kill him? There's so many unanswered questions, just don't know.
You were then making funeral arrangements for your father, trying to help your mother with her grief, and though she tested positive on the 9th of May, and I think you'd arranged your father's funeral for the 18th of May, and you say in your statement that as you were going into the crematorium, you got a call from the care home about your mum. What did they tell you about your mother?
They said at that time that her health was giving them cause for concern. In the intervening period, she had just lost heart and became quite withdrawn and spending a lot more time in bed than would have been her norm. Her norm every day would be to be up and to be in the residence lounge and mixing with people. So it was quite unusual, that. And we weren't really sure if it was grief or if it was COVID. But equally, she didn't have any symptoms. So although she tested positive and had been exposed since at least the 25th of April, even by the middle of May, she wasn't showing any of the key symptoms.
Can I ask you this? You say in your statement that the day that your mum died was the day that in the press there were photos of the drinks party at Downing Street. How did that make you and your family feel, having just lost now your other parent and seeing photos like that?
Yeah, it just felt so cruel, that we had done all the right things, that we had followed all the rules down to the funerals, to then see that. And of course, that picture is regularly reprinted, which means that it just brings that terrible day back all the time.
Absolutely shocking. Right, I've got a couple of following articles on from that to read. So this is back in 2021, I think, this article. This is on Unlimited Hangout. These people are excellent. This is Whitney Webb's outfit. Developers of Oxford AstraZeneca vaccine tied to UK eugenics movement. The developers of the Oxford AstraZeneca vaccine have previously undisclosed ties to the renamed British Eugenics Society, as well as other eugenics-linked institutions like the Wellcome Trust. Now, I'm not going to read the full article. Feel free to have a read of it yourself. But this was released back in December 2020. So they were properly on the ball. And I'll just read a couple of paragraphs just where they mention eugenics. Arguably most troubling of all is the direct link of the vaccine's lead developers to the Wellcome Trust, and in the case of Adrian Hill, the Galton Institute, two groups with long-standing ties to the UK eugenics movement. The latter organisation, named for the father of eugenics, Francis Galton, is the renamed UK Eugenics Society, a group notorious for over a century for its promotion of racist pseudoscience and efforts to, quote, improve racial stock, unquote, by reducing the population of those deemed inferior. The ties of Adrian Hill to the Galton Institute should raise obvious concerns given the push to make the Oxford AstraZeneca vaccine he developed with Gilbert the vaccine of choice for the developing world, particularly countries in Latin America, South and Southeast Asia and Africa, the very areas where the Galton Institute's past members have called for reducing population growth. Not only did like the Eugenics Society, like this Galton Institute, call for reducing the population in the South, but so did a National Security Memorandum of the United States, which is National Security Memorandum 200, otherwise known as the Kissinger Report, in that they wanted to reduce the population because a growing population would put pressure on the governments in the South that would overthrow their governments that were allied with the United States, that were basically puppet states of the US. In the final installment of this series on Operation Warp Speed, the US government's vaccination effort and race, the Oxford AstraZeneca vaccine's ties to eugenics-linked institutions, the secretive role of Vaxitech, and the myth of the vaccine sale being non-profit and altruistically motivated are explored in detail. Now, it goes through another bit. Let me find it, where it's got... Prior to COVID-19, Vaxitech's main focus, especially last year, was the development of a universal vaccine for the flu. Vaxitech's efforts in this regard were praised by Google, which is also invested in Vaxitech. At the same time, the Bill and Melinda Gates Foundation was funding research to develop a universal flu vaccine, reportedly because the field of influenza vaccinology was not yet able to design a flu vaccine that would protect broadly against the strains of flu that infect people every winter, and those in nature that could emerge to trigger a disruptive and deadly pandemic. The Gates Foundation effort originally partnered with Google's co-founder Larry Page and his wife. And Gates is a notorious eugenicist, worried about overpopulation. Yeah, this is a poster published by the Eugenics Society, Galton Institute in the 1930s about cutting bad roots off. I mean, but the thing with these eugenics people, their science has been proven to be a pseudoscience again and again. It's basically in service of the imperialist bourgeoisie. Yeah, eugenics under another name. Despite these safety concerns and clinical trials scandals, close to 160 countries have purchased the Oxford AstraZeneca vaccine. And now reports are suggesting that India, the country with the second largest population on Earth, is likely to approve this vaccine by next week. Yeah, it just gives a bit more information on the Galton Institute and the American Eugenics Society there. And this is at a time when in Japan, they've got a significant increase in excess deaths after repeated COVID-19 vaccination in Japan. And this comes out with some shocking stuff. Let me just find it. Yeah, there we go. So several hypotheses have been proposed to explain the cause of the significant number of excess deaths in 2022 and 2023. And bearing in mind, Japan was one of the most vaccinated. They downgraded COVID-19 from its category as a novel influenza, which required patients with COVID-19 to be treated only at designated medical institutions. And then, skip that bit, another hypothesized cause of the excess deaths is various adverse reactions to COVID-19 vaccinations. Indeed, under its relief system for injury to health with vaccination, the government has provided payouts for as many as 8,432 injuries, including 903 deaths after COVID-19 vaccination, as of November 18, 2024. Numbers that are still increasing and already greatly exceed the numbers of injuries and deaths for which payments were made after all other vaccinations in the last 47 years. The aforementioned cases comprise many injuries and deaths in the young population, including the fatal case of a 14-year-old girl. So, I mean, I think we got hit on both sides, both with the protocols for lockdown, the death protocol was for lockdown, as well as then the vaccination that came in to cure the thing. It's pretty shocking stuff. Keep up with Biology Phenoms Substack. I'll put the links in for the UK and the Scottish COVID inquiries from their YouTube channels. Don't forget to like and subscribe. Share this video where you can, and I'll see you on the next one.